Now we're going to begin to discuss lifespan development, or developmental psychology, and we're going to attempt to address issues that begin at the earliest stages of development with conception, and attempt to cover the process of development that ultimately ends in death, that is, at the end of the lifespan. So this will be our introduction to developmental psychology. And developmental psychology really is the study of age-related changes and behavior and mental processes, as I said, from conception to death. And we're going to take what is termed a topical approach, in that we're going to first talk about the topics of physical and cognitive development. That's going to be the first part of the lecture here. Then the second part, we will discuss the social, moral, and personality aspects of development, or more specifically, we'll be talking about how these things change throughout the lifespan. So, in terms of discussing how these various aspects of our behavior and mental processes change, we generally, developmental psychologists or lifespan developmental psychologists can they tend to divide up the lifespan into different stages, beginning with the prenatal stage, which encompasses conception until birth, okay, or approximately 9 months. Infancy, which is approximately from birth to 18 months. Early childhood, middle childhood, adolescence, young adulthood, middle adulthood, and later adulthood. Each one of these age ranges here, or stages of development, sort of has some characteristic features that allow us to discriminate, say, adolescence from middle childhood, or later adulthood from middle adulthood. At some point, the quantitative changes become sufficient enough for us to consider them as really different parts of the lifespan, because of the fact that the experiences that we go through at one point are really starting to become qualitatively different from those experienced at a different point in the lifespan. And that's actually something that we're going to be talking about, is the idea that development is both continuous, or continuous, or that it's more stage-like. That is, that there are these abrupt sort of changes. So that's what we're going to be talking about. And something that, again, we've already seen a number of times at this point, in terms of some ongoing theoretical issues, include the nature versus nurture debate. Again, nature being the idea that development is governed primarily by maturation, which means that it's relatively automatic, that it's genetically predetermined, and that also there are critical periods. A critical period is basically a time of sensitivity to specific types of learning, or just generally specific types of experiences. That is, if you have a certain type of experience during a specific time period in development, that will result in one developmental trajectory. But if you have that same experience during a different time point in development, you'll experience a different trajectory. Okay, a good example of this has to do with exposure to male hormones during conception. If you're exposed to male hormones during conception, that has the ability to actually shape the development of your sex, so that you'll either become male if you're exposed to those hormones, or female if you're not. Whereas later in life, outside of what we'll call this critical period, being exposed to those same male hormones, for example, a female who's given a dosage of male hormones will not suddenly turn into a male. So that's what we mean when we talk about the idea that there are critical periods, that there's a specific point in time where an individual is susceptible to developing in one trajectory based on an experience, versus developing in different trajectories at different points in time. So then we've also talked about the nurture side of things, which suggests that development is governed more by learning through observation and personal experience. And once again, this comes at no surprise at this point. It's really a combination of both of these factors that ultimately influences the way that we develop. Some other ongoing issues, as I just mentioned a minute ago, is the idea of whether there are stages in development or whether it's just rather continuous. That is, you can't discriminate between one point in development and another based on any specific differences, that they sort of blend in together. So stage theorists tend to take the perspective that development results from discrete or qualitative changes in development. And that's what is more or less implied by talking about stages in development, such as infancy, early childhood, middle childhood, adolescence, etc. It sort of implies that there are these stages, but that it should be known that that's actually a matter of ongoing debate, and the research hasn't clearly demonstrated that it's either one way or the other, but that there is evidence on both sides of things. So the opposite side of the stage change debate is the continuity debate, which suggests that developmental changes are relatively steady and they differ in terms of the quantity of a behavior rather than the quality of a behavior. So it's not as if brand new behaviors develop per se, but rather they just change gradually over time, so that there is either more or less of a given behavior over time. Another ongoing issue has to do with the degree to which development is stable versus the degree to which it changes. So in terms of stability, there's some evidence that indicates that childhood personality measurements are actually relatively good predictors of adult personality. On the other hand, of course, life changes can affect a person's development from childhood to adulthood, such that if you have a particular experience in childhood, you may develop very differently as an adult. The adult that you become may be very different. So this is another area of inquiry in terms of the science of developmental psychology, is what evidence is there that we're relatively stable? What evidence is there that we tend to change? And are there certain behaviors that are more stable than others? Are there other behaviors that tend to undergo greater changes than others? And once again, anytime we see debates like this, it's usually not an either or, but to what degree. That is, the interactionist perspective or the biopsychosocial model is what most psychologists would consider themselves. That is, most psychologists recognize the importance of both sides of these debates and attempt to integrate the approaches in order to really understand development. Again, how much of a contribution does there appear to be from nature and or nurture, rather than is it nature or is it nurture? Now, we talked about research design and research methodology in psychology, but when we study development, we need to use some relatively specific types of research approaches because of the nature of what we're attempting to study. We're not trying to study one behavior in time per se, but we're rather trying to understand how that behavior changes over the course of time. And there are a number of different designs, but there are two very basic designs. One is called a cross-sectional design. A cross-sectional design, you can think of it as just a snapshot in time. Okay, it's like taking a picture basically of how things are, and then taking another picture at a different point in time, and then trying to figure out how did these things change over the course of time. So that you have one group of participants that are, say, 20 years old, and you have a separate group of participants who are 40 years old, and perhaps a third group who are 60-year-old. But you compare them at the same point in time. Let's say that this research was done in the year 2013. And you're looking to draw conclusions such that any differences between these three groups are due to the fact that they're different ages. So again, the characteristic of the cross-sectional research design is that different participants of various ages are compared at one point in time to determine age-related differences. These are age-related differences because that's what we're able to conclude, that the people in these different age groups do not perform the same way on this measure of behavior. Now contrast that with the longitudinal design, in which the same participants are studied at various ages to determine age-related changes. Notice the difference there. Age-related differences are determined by cross-sectional designs, but age-related changes are concluded based on the use of longitudinal designs. So given that we're studying different groups of people in the cross-sectional design, we can never really say that anyone ever changed. They might have been the same way that they always were at the age of 40, but since we only study them at 40, we just know that they're different than the 20-year-olds, and there could be a number of reasons why that's the case. Whereas in the longitudinal design, we study people when they're 20 years old, and if we can keep them if we can keep them in our study long enough, say for 20 years, we know whether or not they changed. You either exhibit the same behavior or you start to exhibit different behaviors over that period of time, in which case we can say definitively whether you changed or not. Now, whether those changes are due to age or not, that's an entirely different question, but these two different types of research designs do answer very different questions. And of course, they have a number of advantages and disadvantages for both of them. The longitudinal design is obviously a much longer type of research project. It's very difficult to keep somebody in a study for 20, let alone 40 years. So to track somebody from the age of 20 to 60 would be incredibly difficult. On the other hand, you can, as I said, really get a good understanding of how people actually change by using this design. In a cross-sectional design, the research is conducted in 1 year, not over the course of 40 years. So it's much more practical. On the other hand, there are a number of reasons that these groups may differ that may be relatively independent of the age of the participants per se. And in fact, another thing that we see is that these two methods, the cross-sectional and the longitudinal designs, did not always produce the same results. So this is an excellent example here. If we look at reasoning ability test scores among people using a longitudinal design, remember that's a design in which we track the same individuals over the course of time. So so from roughly 25 to age 81, that's roughly 56 years. Okay, and what we see, and this is what the data seem to indicate, is that there's that reasoning ability is relatively stable over time. Sure, it does tend to increase from early adulthood into middle adulthood, and then it does decline a little bit from middle adulthood into late adulthood, but it's relatively stable. Okay, if you contrast that with the cross-sectional design, you see that there's a clear decline over time with really no improvement over time. From the age of 25 to the age of 81, there's more or less a downward trajectory. And the reason for this is that in the cross-sectional design, because you're studying people of different ages, there's the possibility that there are what are called cohort effects in there. Cohort effects are differences that result from specific histories of the age group being studied. So 25-year-olds people that are 25 years old in the year, say, 2015, are going to have a very different experience than 25-year-olds growing up in, say, the year 2050. Okay, just imagine in terms of the amount of change in technology. Just imagine going back 25 years ago when there was no internet. People have had vastly different experiences as a function of not how old they were, because you're 25 years old. A 25-year-old in the year 2015 is the same age as a 25-year-old growing up in the year 2050. So it's not age that makes them different at that point in time, but rather the life experiences that they have. And those life experiences, those are what drive these effects called cohort effects. And so we don't know to what degree are people not the same because of cohort effects versus the fact that they are different ages. Okay, and so that's a major limitation of the cross-sectional design, and it's also one of the reasons why we see different results based on which method we use. Okay, so as I said, some of the advantages of the cross-sectional design are that it provides information about age differences. It's relatively quick and certainly less expensive because you don't have to keep people in the study as long, and it typically can use a much larger sample. Okay, longitudinal designs, on the other hand, provide information about age changes, which is actually a greater advantage than age differences. You could have increased confidence in your results because of the fact that, again, you're tracking people over the time, so you can over time, so that you can say whether or not they changed. And again, that's what developmental psychology is all about: is understanding the way that people change over time. That's what development is. And of course, you can also get more in-depth information from participants because you're studying them for a longer period of time. Now, the disadvantages are that there are cohort effects in a cross-sectional design, which make those difficult to separate from age effects. There's restricted generalizability because it measures behaviors and mental processes at only one point in time. But the longitudinal design can be very expensive and very time consuming. Like I said, if you had to pay people to be in your study over the course of 40 years, that would be awfully expensive. And there's also potential reduced generalizability due to the smaller sample size. Because let's say you start out with 100 people in your study in the year 2015. How many people are you likely to have in your study in the year 2050? So over the course of 35 years, how many people are going to be in the same place and still interested in participating in that study? Probably not all of them. And so that's a significant limitation. Okay, so we've talked a little bit about the research methods and what some of the substance and what some of the debates are about developmental psychology. Now let's begin to speak about physical development. So physical development, of course, is going to begin with conception, where the ovum unites with a sperm cell. Only one sperm cell will end up penetrating this egg, and for that reason, if the cell that is formed from the fusion of these two cells doesn't split, only one birth will result. Okay, and the name for this new cell that's created by the union of the ovum and the sperm is called the zygote. And this stage of development is called the germinal period, or sometimes it's called the zygotic stage. Okay, it's the first stage of prenatal development, which begins with ovulation, conception, and implantation into the uterus. Okay, which takes approximately 2 weeks between this fertilization and this implantation period. Okay, now you may have come across the term monozygotic twin and dizygotic twin, and that's where those names come from. Monozygote or monozygotic twins are twins that were formed based on the division of the zygote. Okay, if a zygote separates into two new cells, it's going to have the exact same genetic composition. Okay, that's why monozygotic twins are identical, because they have the same exact genes. Dizygotic twins, on the other hand, two zygotes. Okay, two zygotes mean that sometimes mothers can release two ovum or two egg cells, and it's possible that both of those egg cells can be fertilized. This is becoming even more common with the development of certain reproductive technologies. So dizygotic references the fact that there are two egg cells and two separate sperm cells that fertilize them, and so they are no more genetically alike for that reason than normal siblings who are born at different times are. So the next stage after the zygote stage is, or the germinal stage, is the embryonic period. So this occurs after implantation, which is roughly around the 2nd week until the 8th week. Okay, and the third stage, the longest stage by far, is called the fetal period. This is when we now begin to use the term fetus to refer to this new life form. So this is from 8 weeks until birth, which is somewhere between around 40 weeks or so. And this is when you have increased growth and fine detailing. Fine detailing referring to the fact that the major organs will be formed at one point in time, but they won't be fully developed until later on. And so that's the fine detailing. And the generalizations that we can make about the way that prenatal development occurs are proximodistal, which refers to the fact that organs that are near to the core of the body develop before those that are farther away. So that means that essentially your arms develop before your hands do, your legs develop before your feet do. The internal organs, in particular, the core organs that make up your body develop before the external ones do. And also, cephalocaudal development, another principle, refers to the fact that our head develops first, and then the rest of our body develops later on, such that our brain is present much earlier than our legs because of this growth trajectory. Head to tail, that really means. There are some potential prenatal hazards that are very important to be aware of, particularly in the first 3 months when some might say that this is a critical period. There are a number of factors that can influence adversely the development of the fetus. Some are maternal, such as being an older woman. That is a risk factor rather than being a younger woman. Malnutrition, this can result in low birth weight, malformation, less developed brains, and even general vulnerability to disease. Having exposure to stress during these first 3 months can also result in things like low birth weight, hyperactivity, irritability, etc. Exposure to X-rays, and this is not just one single X-ray, but exposure to higher levels of X-ray than one should be exposed to. This can result in malformations and even potentially cancer. And then, of course, exposure to drugs. Now, being exposed just in general to environmental agents that are potentially harmful to a fetus, those things are called teratogens. And these include things like alcohol and nicotine, but really just any environmental agent that can cross the placental barrier and cause damage to the fetus is called a teratogen. Okay, so just any harmful substance from the environment that a mother could be exposed to is a teratogen. And of course, alcohol, it has some well-known effects. In high dosages during pregnancy, it can actually result in a condition called fetal alcohol syndrome, which is a combination of birth defects that involve things like some physical abnormalities as well as mental deficiency that are related to maternal alcohol abuse. So if we look at prenatal brain development, the brain undergoes obviously some pretty dramatic changes from conception to birth, but just 3 weeks after conception, you can see the beginnings of the central nervous system development, and you can see that there's a forebrain that develops first, in conjunction with a midbrain and a hindbrain. Ultimately, it will be the forebrain that expands to become the largest, even though at just 3 weeks they're all relatively similarly sized. The forebrain will ultimately develop into the cerebral cortex, which looks quite human-like at the time of birth, but at only 11 weeks, it looks much more similar to a non-human organism's brain because it's missing those folds in its cortex. So brain growth occurs at a tremendous rate in the first 2 years. Essentially, as infants learn, they develop synaptic connections between active neurons, which become stronger. The term that has been historically used to refer to this is that neurons that fire together wire together. Firing together referring to the fact that an action potential causes release of neurotransmitter from one neuron, which synapses with another neuron, and the more that those neurons communicate with one another, the stronger those connections become. And the other thing we see is that dendritic connections also become more elaborate. So if we just look at some neurons at birth, we can see that they become extremely more dense over the course of the first 2 years of life. Obviously, the body will change as well, but another interesting thing about early childhood physical development is the changes in the proportion of the size of the head to the size of the rest of the body. That at 2 months, before an infant is even born, the head is disproportionately large, and even at 5 months, it's still disproportionately large. By the time we are full-grown adults, our head is taking up just a much smaller proportion of our overall body size. But early on in development, our head is much larger. And so, for infants, you can understand not only is there muscle weakness, but also just the sheer size of their head in proportion to the rest of their body is one of the reasons that they have a difficulty holding their head up. Now, in terms of motor development in infancy, infants rely primarily on initial reflexes. These are involuntary movements to stimulation, typically, but they eventually will become more under the control of voluntary resources. That is, we gain control so that a reflex that is present during infancy will no longer be present during, say, childhood. An example of this is the Babinski reflex, where you stroke the bottom of the foot from the heel to the toes, and what happens is in infants, the toes will fan out, but outside of infancy, you no longer get that reflexive response anymore. In terms of sensory and perceptual development, many senses are highly developed at birth, but the sense of vision is actually very poor. So, hopefully, as adults or even as children, visual acuity is close to 20/20, and that tends to occur not until about 2 years of age. As I said, visual acuity is very poor at birth. It's estimated to be somewhere around between 20 and 2200 and 2600, meaning that whatever we can see at 20 feet, an infant, what we can see at 600 feet is what an infant can see at 20 feet. Hearing begins a few months prior to birth. There's a good deal of evidence to suggest that infants are capable of hearing, particularly their mother's voice, even before they're born. And how do we know this? Well, because developmental psychologists, especially those who study infants, have to develop very specialized procedures for studying their behavior. One thing we can do is we can look at preferences that infants show for different voices. For instance, infants will turn their head toward a speaker if you have two speakers playing. One is playing mom's voice, one is playing another woman's voice. They'll tend to turn their head more toward mom's voice. They'll tend to suck longer and more vigorously when they hear mom's voice rather than another woman's voice. And these things, the head turning, the sucking, these are all what developmental scientists use in order to study things like infant preferences, since you obviously cannot ask infants what their preferences are. Now, one of the events that is most characteristic of physical development during adolescence, which is the period of development between childhood and adulthood, is puberty, which refers to the biological changes that occur largely as a result of hormone production during adolescence. And during puberty, of course, we see the growth spurt, which is the rapid increase in height and weight, as well as skeletal growth, and the changes in the reproductive structures and sex characteristics. Now, one of the other major milestones in terms of development that occurs during adolescence for women is menarche, which is the onset of menstruation, and spermarche, which is the first ejaculation in males. And as we can see from this growth chart here, females, of course, experience their growth spurt first. So we're looking here in this graph at the height gain in number of centimeters per year, and of course, females precede males in this growth spurt, but males ultimately have both a slightly larger growth spurt and ultimately end up becoming slightly taller. So if we look at some of the other changes in terms of physical development, we see underarm hair growth in both men and women. We see breast development in women, the enlargement of the uterus, as I said, menarche, or the beginning of menstruation, as well as the growth of pubic hair. Whereas in males, we see the enlargement of the larynx. This is one of the physical changes that results in men having deeper voices. We see, of course, the growth of pubic hair and growth of both the penis and testes, as well as the beginning of ejaculation during adolescence. In middle age, in terms of physical development, one of the major milestones for women is menopause, which is the cessation of menstruation. During this time, we see decreased estrogen production. In fact, for a while, there was actually quite a bit of controversy about the degree to which women should be undergoing estrogen replacement therapy or hormone replacement therapy, which includes estrogen administration. Because although it does seem to reduce some of the uncomfortable symptoms of menopause, there are important risk factors that may and in fact are likely to outweigh the benefits that are achieved from hormone replacement therapy. One thing that is actually more of a misconception about menopause is that it does not cause the drastic mood swings that are typically attributed to menopause, nor does it include or result in or cause there to be a loss of sexual interest or depression. In fact, many women during this time period report relief and even an increased libido. One of the factors that may be influencing the way that women are viewed during this time period in their life may have more to do with the social devaluation of aging women. That is, younger women might be more socially valued than older women, and so because of this prejudicial behavior, that can actually cause people to develop the certain stereotypes about them. Men, on the other hand, experience a male climacteric, which is really a gradual decline in both testosterone and sperm production. Now, of course, men can continue to reproduce into their 80s and 90s. It simply becomes more difficult, both because of changes in sexual behavior and erections themselves, as well as the reduction in their sperm count. They also experience some weight gain, graying, or loss of hair, as well as decreased sexual response and muscle strength, largely related to decreases in testosterone production, which again has triggered scientists to develop potential treatments for that, including testosterone therapy, which has itself, just like hormone replacement therapy for women, became controversial, and now it's turning out that there are actually some adverse side effects of testosterone replacement therapy in men, and so the research is a little bit less definitive in terms of what the exact benefits and exact risks are in testosterone replacement therapy, but those things will become more clear as more and more research is conducted in the coming years. Now, in late adulthood, most changes are gradual, but there is a pretty reliable decreased cardiac output, meaning that individuals' blood flow is not what it was, although there is increased blood pressure. That is, the heart is actually working a little bit harder to pump blood because the blood vessels are not as pliable as they once were. They become a little bit stiffer, in part because of buildup of plaque on the walls of the arteries, but also the senses decline. Visual acuity, depth perception, hearing, smell, and even taste all show some decline. Of course, our cognitive abilities are also affected, so there's a reliable decline in information processing speed, which just refers to the amount of time that it takes us to process information. So if just as something as simple as if somebody asks you a question, the amount of time it takes you to process what that question is, as well as to formulate a response, can be slowed down due to a decrease in processing speed. The ability to encode information, which we talked about as being one of the first steps in memory formation, declines, as well as retrieval, which results in more tip-of-the-tongue phenomena experiences, where you have difficulty retrieving the word you want to use, even though you feel like you know it. For instance, if you know somebody's name, you might have more difficulty retrieving the name of that person. It might take you longer to do that. However, most of memory function is retained, and in fact, because of the fact that there's an accumulation of knowledge, this can actually aid in one's memory capacity. However, older adults do tend to battle prejudicial or discriminatory behavior based on physical age, which is called ageism, and even though older adults may not be changing for biological reasons, having to do with changes in their brain and other biological organs, they may behave differently simply because of the prejudicial or discriminatory behavior that they experience. Now, in terms of explaining why some of these changes in late adulthood occur, there are two general theories that attempt to explain why the aging process occurs that it does. One is called program theory, which suggests that aging is genetically controlled. So some research to support this theory comes from the fact that cells can only seem to reproduce a certain number of times in laboratories. That is, after they've reproduced a certain number of times. This is actually called the Hayflick limit, named after the researcher Leonard Hayflick, who discovered it. So if our cells become less and less capable of replicating over time, that's one theory that can explain what aging is. Damage theory, on the other hand, suggests that there's an accumulated cell and organ damage that ultimately causes death. So just like, the older your car gets, the more damage occurs to it from just the elements and use and things like that. So damage theory proposes that basically a similar process is occurring in terms of our bodies. And the maximum lifespan for humans really refers to how long we can live under the most ideal circumstances. That is, if we don't experience any of the secondary aging factors that are, the result of disease or illness, then again, under the perfect circumstances, it appears that people could live to be about 120 years at the most. Okay, so now we're going to talk a little bit about cognitive development. And when we talk about cognitive development, the first name that always comes to mind is Jean Piaget, okay, a very famous Swiss psychologist who studied his own children and developed some very strong and empirically supported theories about cognitive development. Okay, so when Piaget talked about cognitive development, he said that individuals develop these things called schemas, and schemas are really the basic units of intellect. You can think of them as cognitive structures or patterns that consist of a number of organized ideas that grow and differentiate with experience. So sometimes a schema can be synonymous essentially with a concept, which we talked about previously. So you might have a schema for what a bird is, right? That a bird is an animal that flies and has wings, and so for, say, a young child, they might see a flying organism and call it a bird. Regardless of whether it is or not. If our schema says that birds are things that fly, then anything that flies might fit into that schema, and these schemas get modified through the course of development in two ways, Piaget asserted. One is through assimilation, in which we apply existing schemas to new information. That is, new information becomes incorporated or assimilated into existing schemas, as opposed to the process of accommodation, which is adjusting existing schemas or developing new ones to fit with new information. So an example of this would be, as I said, you have this schema for what a bird is. You might know what a pigeon is. A young child might develop a schema for a theory based on pigeons, and then they see other types of birds, such as robins and blue jays, and they assimilate those new experiences into their existing schema, so that now these are also creatures that become subsumed under the broader schema of bird. On the other hand, a child might learn, again, using the schema that a bird is something that flies. They might see a bat for the first time, and they learn that a bat is actually not a bird, that it's a mammal, and so now they need to adjust their existing schema so that, say, a bird is not just something that flies, but there are also other features such that it has to lay eggs as well. Now, Piaget is famous for coming up with 4 stages of cognitive development. Okay, the first stage encompassing birth to age 2, which he called the sensory motor stage. Okay, it's called the sensory motor stage because that's primarily how children learn about and explore the world, through their senses and through motor activities. One of the main important features or behaviors that develops during this sensory motor stage is the idea of object permanence. And object permanence refers to the fact that children develop the ability to think about objects even when they're not directly exposed to them. So the classic example of this is a young infant that does not yet have object permanence is fascinated by peekaboo, because once you cover your face, it's as if you're no longer there anymore. And that's because if you don't have object permanence, then out of sight is literally out of mind. On the other hand, once a child has developed object permanence, they continue to recognize that even though they can't necessarily see the object, that it still continues to exist anyway. The second stage is called the pre-operational stage. And pre-operational refers to the fact that infants, or rather children, these are no longer infants because we're now past the age of 2. Pre-operational refers to the fact that they can think symbolically, but what they cannot do is they cannot perform operations. Operations referring to the idea that some things are reversible. For instance, if a boy who has a brother is asked, "Do you have a brother?" he'll respond yes. But if you ask that same child, "Does your brother have a brother?" he won't necessarily answer yes. In fact, he might say no. Even though, if I have a brother, then he by default has to have a brother as well. Those things are reversible. The other thing that characterizes the pre-operational stage is egocentrism. and egocentrism refers to a sort of self-centered type of view of the world. Not self-centered as in uh, uh, how we might characterize an adult as being egocentric, meaning that they have an inflated self-esteem or something like that, but rather they have difficulty understanding other people's points of view, that other people have points of view that are different from their own. That's what egocentrism really refers to. The third stage is called the concrete operational, and it's called concrete operational primarily because of the fact that at this point, children have difficulty thinking abstractly and hypothetically. So concrete is sort of the opposite of thinking abstractly. Their thinking tends to be tied to concrete, tangible objects and events. They can perform operations on concrete events. They understand conservation, which means that, say, the classic example of testing conservation involves taking two containers that have equal amounts of fluid, liquid in them, and putting them in different containers. While the volume is still going to be maintained, one of the containers might be skinny and tall, so it might look like there's more in that one. The other one might be very wide, and so it might look like there's less in that one. That's what conservation refers to, and this is the point at which children begin to understand the concept of conservation. They also become less egocentric and can think logically about objects and events. This is also, interestingly, around the age at which children might begin to question the existence of Santa. Okay, the final stage in Piaget's theory is called a formal operational stage. And the formal operational stage is characterized by abstract and hypothetical thinking. So at the beginning of the stage, adolescent egocentrism is still present, but as development progresses, they become less egocentric in their thinking. Early on in adolescence, part of this adolescent egocentrism can be seen by the personal fable and the imaginary audience. The personal fable refers to the idea that adolescents many times feel like they're the only ones that have undergone certain types of experiences that, for instance, your parents would never understand. It's not as if your parents were never adolescents themselves. They most likely went through some very similar experiences that you did, but as an adolescent, you tend to not be able to think about the fact that plenty of people have been adolescents before you, as well as at the same time as you, and so your problems are not necessarily as unique as you might think. And that's what the personal fable is. The imaginary audience is the idea that you're always being watched by other people, that other people are more attuned to what you're doing than you really are. But as I said, in terms of their cognitive functioning, it's really the ability to begin to think more abstractly and hypothetically and be less concrete in their thinking that really characterizes this fourth and final formal operational stage. Now, in contrast to Piaget, there was another very famous Russian psychologist by the name of Lev Vygotsky, who emphasized the sociocultural influences on a child's cognitive development. He suggested that the way that cognition develops in children is through factors such as culture and language and a collaborative social interaction with more experienced thinkers. And so he talked about this concept called the zone of proximal development. And the zone of proximal development is essentially the difference between the upper limit, which a child cannot do, or an individual, I should say, cannot do at present, and the lower limit, which is what they can achieve without help. That's the zone of proximal development. And Vygotsky argued that the way that cognitive development occurs is through getting assistance from those who are more sophisticated than us, and that helps us to raise that upper limit a little bit. And that's how Vygotsky said that cognitive development takes place. That the most effective teaching focuses on tasks that are in between those that the learner can do without help. Again, that's the lower limit, and those that he or she cannot do even with other people's help. But the idea is that you increase that upper limit through working with somebody who is at a higher stage of cognitive development. And so that's where the social aspect of Vygotsky's theory really comes in.